Even this patient I discussed before, and even as Dr. Lee, I have a lot of younger patients that are not as severe as that, but it does have that kind of impact where it seems to get at the root of the problem, solve it more or less, and maintain it as opposed to it coming and going. And there's another technology that's very big. I mean, you see it marketed very much by a manufacturer, Johnson& Johnson. It's called LipiFlow. And we have access to a LipiFlow as well. We share it with another doctor. And I've used it. I've had it done on myself, but also on other patients. So I could compare directly. And I've had so many patients that have had that. That technology is technician driven. It's very automated, which is good in some ways. But in other ways, there's sometimes judgment that the doctor needs to put in here to see that the meibomian glands are being cleared, that it's the right temperature that liquefies the stagnant substances in the glands. And then also when it's expressed, when the lids are squeezed, that it's all coming out, that they get it all out. The LipiFlow doesn't do that. I think that's where there's a limitation on that. So at this point, we've switched over just about totally from LipiFlow to the iLux, because first of all, there's a video feed that when the procedure is being done, that the doctor can actually see that there's liquefaction of the substances in the glands. When it's expressed, it's coming out, and there may be more that has to come out. So it could be more pressure could be applied if need be, or just for longer. And you have a feeling at the end of this that everything has been cleared out. You've done as much as possible. Whereas in the LipiFlow, it is kind of a guesswork. There's another technology called IPL, which involves using a laser that cuts down on inflammation, but those are in more specialized cases where there's extra vascularization that takes place. There are possibilities for other modalities to come into this as well. But the bottom line is to get those glands working better so that the integrity of the tear film, not even the amount, the integrity of the tear film normalizes. Again, this happens for a multitude of reasons. There's medications that people are on that make their eyes dry, just the biochemistry in the eye, if somebody's a contact lens wearer or not, like a certain bacterial counts that get into these glands. There's just people who are at computers that are not blinking enough or driving a lot, and it addresses all those. So the good tear integrity crosses all those lines.
One other thing I would add from patient feedback, I've had patients that have had LipiFlow done previously, and I've asked them about their experience comparing the LipiFlow with the iLux. Patients do like the fact that the doctor's more in control. So they know if they're having, some issues more in one eye versus the other, or if they've had like a previous sty in one eye versus the other, or a certain area that they want to address, I can spend more time and individualize their treatment compared to the LipiFlow. It just works generally on all areas of the lid. So the patients end up feeling like they're getting more, I feel like, out of the iLux versus their experience with LipiFlow. Both work well, but this one is definitely a little bit more manual, so you can get to the root cause of the gland dysfunction.